The first time IBD was introduced into our home was obviously with our 3-year-old son who was having some bleeding and stuff, some scary moments. We didn't know what was going on. And so that moment that you hear of a diagnosis for your child and you know they're going to wrestle with this for a long time, maybe the rest of their life, it's going to be difficult.
I was overwhelmed, and I remember when the doctor came in and told me, I felt for the chair so that I could sit down.
Well, initially you feel helpless because you're supposed to be able to solve things. But the goal right now is to live a healthy life, emotionally and as physically possible as we can.
There'll be points of being sick, and especially when you're first diagnosed, it's definitely a process to get better. But I know that it's possible to get better because I'm in it right now.
And you find will, which is the will and determination that you see in your child, and you find in yourself, and you get through it.
There was so much relief based on getting treatment started right away and seeing the results with that treatment was a beautiful thing.
I was scared about it, but then I was also kind of not scared because I knew they would do something about it.
So I would say be patient with yourself and your child in learning about this disease. It's a process.
And it's encouraging to me that there's people working together, families with the medical community here at Children's to improve the lives of these kids.
We try to really work with families and make decisions together and try to focus on the whole patient, whether that means the medicines they're on, how they're doing physically, emotionally.
We really appreciate the team concept here at Children's Mercy because there's a lot more to helping to take care of kids and families with IBD than just the medicine alone. We listen to the individual needs of the families to help tailor our treatment plans to what works best for each family. It definitely depends on the location of the disease, the severity of the disease.
It's been a blessing to have a team supporting you and giving you the right treatment and the right answers and seeing your child a different person from where they were in a positive way.
And over the years, we've found that same team of people, here we are 7, almost 8 years later, and a lot of those same faces are still here. And I think to me, that's a comfort.
I am a healthcare professional myself, so I had high expectations, and I knew what I was looking for. And I can tell you that Children's Mercy, with the utmost knowledge and dedication from their team, met my expectations, and that I knew when I left I had confidence every day. And I was able to validate that this is the one and only place that I would want my child to be.
Interaction with the families is probably the thing I enjoy the most. Getting to know patients and their families, hopefully helping patients and their families through some tough times, and then being able to kind of enjoy the later visits when they're doing a lot better and they're back to good health is really enjoyable and rewarding for, I think, all of us here.
This disease really has a lot of awful side effects to it, but with the right medication, the right tools, the right team members, we do have what it takes to make patients better and feel better and go on and live a good, healthy, happy life, and that is our goal.
Everything's good because I have been taking the medicine and I've gotten a whole lot better, and I'm feeling just like back to normal.
He plays baseball. He plays on a competitive league. He's out there and playing like he has no worries. It's been beautiful.
If you're playing sports and you have Crohn's, if you take the medicine, it's not going to hold you back. You can just keep on playing your sports.
It's still part of your life, but not the whole. You don't have to stop doing anything that you did before necessarily. That you can still have a normal life just like anyone else.
I think the best moments were those times when you saw that the treatment was starting to work. And then you knew that it was going to be a life journey, but it was a journey that you could help do. And you can't take it away from your child, but you could at least feel that you had them on the right path.
Who wants their child on medication the rest of their life? Not a lot of people. But when you see your child changing for the good and symptoms subsiding, it does bring peace of mind to you knowing that he's going to be just like the other kids and can do everything anybody else can do.
Living with this disease with our son for a number of years, I find a lot of hope and a lot of comfort in just knowing what to do, who to call, how the process works. And I would say that families just, if they'll take the time to step back and really listen to what their doctors and nurses, the direction they give them, hopefully they'll find that comfort too.